Hello, everyone.
Hi, how are you?
I'm fine. How are you doing?
Good, good.
Hello.
Good afternoon, everyone.
Hi, good afternoon.
Good afternoon.
Good afternoon.
Hello, everyone. Welcome. We'll just give a couple more minutes for everybody to join as we get started. Feel free to introduce yourself in the chat, to add which country you're from after your name, and we look forward to having everybody starting in just a few minutes. Hi, everyone. People are slowly joining, so go ahead and introduce yourself in the chat as you come in. We also have some house rules just up as everybody joins. And we encourage you to use the Menti code below on the screen so that you can share what country you're coming from. We'll just give it one more minute for people to join, and feel free to use the Menti code and to continue introducing yourself in the chat. Okay, I know that people are still joining, but we have a really packed agenda today, which I'm super excited about. And so we'll go ahead and get started. Um, just with a bit of background on GISP, I think all of you at this point are mostly familiar with the Global Initiative to Support Parents, but just to give a little bit more information for those of you who might be joining us new, there's really a big need to have a platform that brings together different partners who are working across the life course, across sectors, and across regions on parenting, because we know that only about 1 in 4 governments say they're reaching all parents who need it. And we also know from surveys of things like BEBO, the UNICEF parenting app, that only about 3/4 of all parents say they're not getting the help they want or need. But we know that there's also strong evidence for effectiveness of parenting programs in different settings, and interventions are frequently siloed, which is leading to a global parenting crisis, necessitating something to bring us all together. So the Global Initiative to Support Parents has a vision of enabling all parents and caregivers to access quality, evidence-based parenting support according to their need, by working with governments, civil society, researchers, academics, donors, and other partners in order to achieve that goal. And GISP is coordinated by a series of 5 partners, but really wants to be an inclusive platform for everyone to share their knowledge and learnings. And GISP operates across 4 pillars: advocacy, evidence generation, innovation, and scaling, and has a series of qualities that we encourage in parenting support initiatives. So evidence of impact, low cost and non-commercial, open source and adaptive, scalable and sustainable, and encouraging policy partnerships. But one thing we really love being able to do in GISP is to represent different country voices and visions. And that's what we really wanted to do today to wrap up Parenting Month. So many of you may have been on the town hall that we had at the beginning of the month to open Parenting Month, and we were able to hear about all the different plans for different places and events around the world. We heard about plans for International Day of Play, the first one ever. We heard about plans and the tools you can use to promote Parenting Month in your country. And now at the end of Parenting Month, we're really excited to hear from a lot of the countries about what they're doing and what they're planning, or what they've been working on for the past month, what they've been working on to support parents and caregivers in their countries and beyond. So we're really excited to have an amazing lineup of countries and different speakers here today who will be sharing about their work. We've got Botswana, Bhutan, India, Iraq, Jamaica, Jordan, North Macedonia, Pakistan, and South Africa here today. And we're really excited to hear from all these countries. And I don't want to take up too much of your time, and I would really like to hear from all of them. So I'll go ahead and get started sooner rather than later with our countries. I have heard that we're going to switch the order up a little bit. Priyanka from Botswana is not here yet. So once she gets here, we'll go back to Botswana. But in that case, we're going to be starting with Bhutan. And do we have Karma online? I'm not seeing Karma online as well. Maybe she's having a bit of delay too. So in that case, I'm actually going to go ahead and jump to India with Jayanti Prakash. So Jayanti is coming to us from Sesame Workshop India. And I'm very excited to introduce them and to turn turn everything over to them so that they can share. And I'm just going to go ahead and jump forward to India.
Thank you, Amanda. I'm Jayanti Prakash from Sesame Workshop India, and I am presently Director of Content and Curriculum. We have many initiatives on parenting, some of which are like cross-cutting throughout our programs, but we have one focused initiative on parenting, which is called Daddy Cool. And it's based on promoting fathers' engagement. It is a program that has been ongoing from last 4 years in India. It's based in Lucknow, in the slum areas, and the uniqueness of this program lies with the father's engagement as an entry point to ECD, and also it's a platform that we have provided to fathers for having those men-to-men conversations, which ultimately aim at promoting emotional engagement with children, to have play-based engagement with their children, and also to challenge gender stereotypes and reduce adherence to gender norms so that they have more role in caregiving and resume the role of a provider to a nurturer. So this is a program which runs through workshops. So we have developed a set of content, which is a multimedia content in the form of radio episodes, as well as audio episodes, as well as the print content, which is delivered through the workshops. Now there are a set of 24 workshops, and it's an engagement of 6 months, one workshop per week with the fathers. And we have a team of facilitators on the field who are specially trained to hold these workshops with the fathers. These are duration of 45 minutes to 1 hour, usually in the evenings, to align to the timings that the fathers are available at. And the conversation goes on this workshop about how to engage with children, what are the gender restrictive norms that we're talking about, and how do we increase our caregiving role within our families. So with the content and the engagement, what we have seen is that there has been an excellent retention rate. Though we provide no incentives to join this program, there has been a participation of 96% fathers throughout the workshop. What we have also observed is there have been a reduction of abusive language at home. There's improved communication and behavior within the household, but the children and the mothers are also communicating that there's increased quality time and playful interaction with the children at home. No, so what we have been doing this program at a community level, but now we have realized that we, as we are scaling up and we have reached more than 1,000 of fathers, scaling up will involve institutionalizing the programs, which is why we are now recruiting the fathers to the government-run preschools. And this is also the focus area this month. We are also piloting a home-based learning app called Chalo Sesame Street, which has learning content for children in the form of YouTube videos, which are delivered through the app. And fathers can use this educational videos to engage with their children in a play-based learning format. So for looking forward and the plans for the future, we are also rolling out a buddy system or a mentors program. So the fathers that we have impacted in last 3 or 4 years, they now have become champions in terms of fathers engagement. And now some of these fathers are really noteworthy in terms of their articulation. So we are engaging them as mentors to conduct these workshops further and scale up this program. And we are using adult learning techniques to draft our workshops so that this, when you have interactions with the peer, the learning is much more, is what we have discovered. Also, then we are also engaging in an RCT of the program. We already have an established content, dosage, methodology, but with RCT, with JPAL, we are going to study the efficacy and the scalability of program design so that this could be scaled at a state or national level. And then we are engaging in communities through preschool with over 250 fathers right now. What we can do better with GISP is that we can share the learning, the content, also for the curriculum design and the program design with the partners so that one can also learn and implement these in their own spheres of influence. So I'm open to any questions, queries.
Great, thank you so much. This is great to hear about. I would encourage everyone to hold on to your questions for right now and to put them in the chat or to wait for the end, because we have a lot of country speakers and I want to make sure we have enough time for all of them. But feel free to put them in the chat. I encourage everyone to continue the dialogue there. And next, we do have Priyanka online now, so we're going to go to Botswana.
Thank you so much. And thank you so much. It was great to learn from the amazing work that's being done in India as well. So I'm Priyanka. I am the co-founder and CEO of Learn to Play based in Botswana. And I'm really excited to share with you some of the work that we've done this month for Parenting Month. I'm going to start with what we did as an activation for the International Day of Play. So if you don't mind, Amanda, can we go to the next slide? Thank you so much. So on the International Day of Play, we actually did an intervention or an activation with parents, healthcare workers, government officers, policymakers, teachers. But the majority of the people that you see in that picture are actually parents. And we had a particular focus on mindful play. So play for social and emotional development, play for mindfulness and focus and calming strategies. And we created an open source document with mindful play games that parents could take home and do with their children that are completely no resource, so that they can be used regardless of any of the backgrounds that the parents and families come from. So these included things like yoga and the use of positive affirmations, breathing exercises, creativity and imaginative play prompts. And everybody, like I said, we did these activities together during the activation session, and there were some children present as well. And then everybody went home with their how-to guide. So it was a full booklet with all the activities that we covered during the session so that they could then go home and continue to do them with their children. This was in collaboration with the government of Botswana and with UNICEF Botswana as well. But in addition to that, we do have a program, a parenting program called the Parent Playbox. So that's on the next slide. The Parent Playbox has been developed by ourselves here, Learn to Play in Botswana, and our partners in South Africa, Kids Collab. And what it is it's a comprehensive early learning program for the home environment. It gives parents 52 learning activities, one for every week of the year, for children aged 0 to 6, with a particular emphasis on social and emotional well-being, as well as physical development. And the reason for that is when we've done parent consultations extensively across communities in Botswana and South Africa, what we've heard back from parents is this is the area that they feel least confident to do themselves at home. So they feel quite confident to help children with their numbers and their colors and their shapes and their letters. But in that 0 to 5 area where parents feel least confident is how to create that connection, that nurturing approach in terms of social and emotional learning, what social and emotional learning even looks like for 0 to 5, and how to help children meet their physical development milestones. So really our Parent Playbox kit focuses on that. And during the month of June, we have got a program that we've been implementing in the Dukwi refugee camp in Botswana. On World Refugee Day, also in June, we went and had a big session with the parents that are currently, and this is one of the parents that you see in the picture in the refugee camp, that's currently implementing the program to tell us how it's going for them so far. They're 3 months into this program, and give us feedback and tell us what's working and how we can improve. And one of the most amazing things that's come out of it is how parents talk about how, more than anything else, this Parent Playbox is strengthening the love between children. And I think dads in particular are saying that to us, that we didn't know how to show love to our children, but suddenly through play, we can show our young children love. And I think that's been the most powerful takeaway that we've had from the Parent Playbox, especially, I think, in line with everything that's been going on this month. And then lastly, thanks to the pulling together of and the kind of force of GISP, we have contacted multiple other organizations within Botswana that are working with parenting initiatives. And so we have written an article collaborating to the magazine, that's a multi-organizational collaboration. And what we've taken is a really wide-scale approach from 0 all the way to 18 of what parenting support and initiatives there are in Botswana. And what we found, and I think it's been a great learning experience to play, is how diverse these parenting programs are, not just from the NGO community, but even from the government and what they're doing to support child development and family well-being. So the 3 that you'll get to read about next month when the magazine is published are Youth Impact, Hope Worldwide, and of course our work at Learn to Play. And Youth Impact is an incredible organization that has kind of pioneered teaching at the right level in Africa, but program here, particularly with parents, called Connected, and it's a phone-based tutoring program. And what I think the most amazing thing that I learned when I was when I was kind of getting this information from Youth Impact to pull together in the magazine, was that when parents got involved with this remedial work with their children, just through the phone, just through targeted SMSs, children's engagement and results went up by 100%. So it doubled the engagement levels. And I thought that was really, really incredible. Just as simple as a parent being involved, what a dramatic impact that made. And then Hope Worldwide actually implements some parenting for lifelong health programs in Botswana. And one of them is really about relationship building and about building trust with teenagers. And they've had some incredible results out of their program called Pinagare. And I think it's been adapted to the Botswana context, but it's originally developed by Parenting for Lifelong Health and Clowns Without Borders. And then I think, we've covered what the Learn to Play Parent Playbox is. And so in the magazine, you'll get to know a little bit more about all 3 of these organizations. And I think that the real thing that stood out for me as this month comes to an end is how, when we kind of collaborate just in terms of knowledge sharing, how much more there is that we can learn from each other, how much best practices, and how you start to see this this holistic picture of a systems-based approach. And when you're working on your own, you can sometimes feel quite lonely, or it's looking at something like what Youth Impact is doing, maybe with primary school children, and what Hope Worldwide is doing, with teenagers. I think you start to feel a lot more hopeful about the future, especially in your own countries, and how much is actually going on to support parents and families at the different levels. So I think, when it comes to future plans and what we need to do more together, I think, just to echo what Sesame said as well, is really, not reinvent the wheel. Really, yes, focus on your area of expertise, but then partner with those that have expertise in other areas, and how much you can learn from each other and build upon each other's work when you do that, and not be threatened or kind of competitive, but rather just collaborative, because really we're working towards the same higher level impact. And I think that's really been the big takeaway that I've seen. I think another big thing that we can take away from each other and in the work that we've been doing is, how can we partner with each other to use each other's programs, or at least to refer to each other's programs? So Learn to Play thrives on partnerships. We're looking for partners to implement our parent playbox, continent-wide. And so similarly, if there are ways that we can support partnerships in Botswana, that's something that we're really open to. And one of our big goals for the next 12 months is to start open sourcing a lot of our mindful play and well-being content for parents. So I'm going to leave it there, but I'm very happy to answer any questions in the chat or at the end. And thank you again so much to the Global Initiative to Support Parents platform to share our work and share more about what's happening in Botswana.
Thank you so much, Priyanka. This is fantastic. And I see you have a couple of questions in the chat as well, so you might want to take a look at those, but we're also happy to have a bit of discussion at the end if time allows. So next, I'm very happy to turn over to Bhutan, and I believe Karma is online. Karma?
Thank you, Amanda. So hello, everybody. My name is Karma. I'm the Senior Education Program Manager for Save the Children Bhutan office. Today, I would like to talk about a playful parenting program that we are implementing in partnership with the Ministry of Health and the University of Medical Sciences of Bhutan. The project, in short, is called Prescription to Play. And this particular project is designed around Save the Children International's Building Brains Common approach, which is very closely aligned with the Nurturing Care framework. Essentially, the program focuses on helping mothers and fathers and caregivers feel confident about engaging in playful parenting with the children, and also in the use of positive parenting practices and responsive caregiving practices, which ultimately will contribute in a big way for children's healthy brain development and their holistic development. Next slide, please. So this project focuses on delivering two key services. We work with the in-service health workers all across the 20 districts of the country. The health workers have been trained to conduct two types of sessions. Firstly, the Prescription to Play, or in short, P2P group sessions, all involved around health workers teaching, demonstrating, coaching caregivers of 0 to 3-year-old children how to play with children, how to sing, how to engage and talk, in reading pictures and telling stories, and also in terms of how to use positive parenting ideas and responsive caregiving tips in their day-to-day lives at home with their babies and young children. And the other very key important service is screening individual children for developmental delays using the Ministry of Health's child development screening tool for 0 to 5-year-old children. Our project focuses on children 3 years and under. So the health workers deliver these two key services all across the primary health centers and the monthly outreach clinic, coinciding with the monthly outreach clinic day, once a month. So there are 9 group sessions and 3 additional monthly playful group sessions covering health, nutrition, and caregiver well-being. Next slide, please, Amanda. So what we've noticed is that there are now certain outcomes, benefits coming through these interventions. In terms of the workforce outcomes, we've noticed that for both the in-service health workers and the pre-service health workers being trained by the University of Medical Sciences of Bhutan, we've noticed there is an increase in knowledge and in terms of their skills and confidence to deliver the playful parenting group sessions, as well as the individual child development screening sessions. For caregiver too, there are certain improvements in terms of caregivers now being knowledgeable about what early childhood development is, and also about how they can play and engage and have those, meaningful interactions with their babies and young children. And at home, we've noticed that the home environment too is showing more play materials, homemade play materials, and caregivers, both mothers and fathers, have now increased interactions with the children in terms of playing, in terms of responding to the children's need, and also in terms of singing and dancing or engaging with their young children. Next, please.
Thanks, Karma. And just a quick message to wrap it up too. This is a great slide, but to wrap it up so we have enough time for all speakers as well.
Okay, so the last slide is just about, second last slide though, is about some testimonials from some caregivers and the health workers, all talking about how now they've understood that even the youngest children, even babies, respond to play, to early stimulation, that caregivers now realize that they can play as a part of their daily routine while conducting their household chores, caregivers being appreciative of the health workers, showing them all these wonderful ideas of how to engage with the children. The health workers noticing vast improvement in caregivers when they first attended the first session, the playful parenting group session, and now as they progress and they participate in more sessions, caregivers improvement in terms of their interaction with young children. And we have a lot of a few more important things to do. The biggest thing we now have to do in terms of a way forward is advocating with the Ministry of Health to sustain this playful parenting intervention. And again, expanding to new partnership with the Ministry of Education and Skills Development in terms of integrating playful parenting in their ECCD Center program. So thank you, Amanda. Sorry for taking a little more time, and look forward to any comments or questions later. Over to you, Amanda.
Thank you, Karma. And feel free to add any comments or questions for Karma in the chat. So next we have Iraq, and I believe we have Hadil online. Hadil, do you have any slides that you'd like to share?
Hello, everyone. Hello, Amanda. Can you hear me?
Hi, Hadil, go ahead.
Okay. First of all, good evening, everyone. Good morning for those who have morning now. Actually, first of all, I apologize. I cannot open or turn on my camera because the internet quality currently is really poor. So I'm going to present, but I cannot open my camera. Is that okay?
Yes, go ahead.
Okay, thank you so much. So first of all, it's an honor for me to be part of this great event and to meet all of you. Actually, I'm Hadil. I'm the Child Protection and Education Specialist. I work with War Child and Different Education of Iraq. We see and work with different children, parents. We visit houses, speak with families and children. We provide parents workshops and sessions focused on mental health and positive discipline components of children. Actually, the outcomes and the lesson that we learned throughout our implementation in the different locations of Iraq, we reached like enhanced parenting skills. We increased child development and protection awareness. We increased the mental health awareness within the families and parents that we are working with. In the future, we are planning to expand our reach and target more families in need, and also to expand our collaboration with the schools, local organizations, and private sectors. What we expect and looking forward is to resource sharing and develop contextualized program within our Iraqi context, and to explore funding opportunities to target parents in need, so we can develop the communities, as healthy parents always mean healthy children, and thus we will raise the coming generation. In the areas that we are working in, we target like most vulnerable people, including the children who are associated with armed forces and armed groups. And those children suffered during the crisis, and also when they return to their communities, they face a lot of issues to reintegrate. So the families, or the mothers mainly, they are struggling to be reintegrated and support their children. So the programs, throughout the programs that we implemented, we increased their flexibility, their ability to support their children. And that was during very short period, but still the results were very high, and still the needs is still there, and we have a huge need in those areas. But still, because of the funding opportunities, we couldn't continue to implement our programs. But still, we are looking forward to collaborate more with the stakeholders, with the local organization, to make stronger partnership in order to reach more children and more families and to support them in different ways. And now Amanda, my colleague Reem, she's from SODAC, one of the organizations that we worked with in partnership in Anbar Governorate in Iraq. She has also presentation. So yeah, Reem, over to you.
Great. I
Thank
see
you.
Reem has come up, so welcome, Reem.
Yeah, thank you, Hadil, and thank you, Amanda. This is Reem, Program Manager for SODAC. We are a local organization, and we work specifically in Anbar, especially after the Anbar crisis. According to our activity or the key activity during the Parent Month, Parent Session and the workshop, in addition to the assessment and FGT based on their need. About our lesson learned or the emerging lesson learned to share, strengthen the family relationship and bonds, having a clear understanding about the parents' need in Iraq. From our point of view, what's the plan for the future? Implementing focused program on the parents and raising the awareness of the child right and the importance of the parents' role. Specifically in Anbar, we have a lag in the organization that have thematic direction on the child right, or they work on the program that focused. I'm talking about the local NGOs that take in their importance or in their program or in their direction the child right. Also, the other point that we need to add to the plan for the future is targeting more family, as we have a huge number of family in need. What we can do better together, we are looking for or explore more resources to support the parents and the ability to study and follow the program that can targeting the parents. That's all from my side.
Great. Thank you both for that efficient and really interesting presentation. Again, keep putting your comments and questions in the chat and continue the conversation there. I'm now going to go ahead and hand over to Corinne from Jamaica.
Good morning, everyone. So I'm Karine Francis, the Community Interventions Officer with the Early Childhood Commission. And just to highlight some of the key activities that we've been doing during Parent Month, we have our parent place meetings. Now, we have 86 parent places in Jamaica. We deliver a 13-week curriculum to our parents. And for Parent Month, we would have focused on play. So we are teaching, or rather reteaching our parents how to play and to let them know that it's actually a fun way in which they can interact with their children. And here we would have actually, a little later on, you'll see the slides where they can actually use play as a teaching tool to learn more about their children and also to learn more about themselves. We have our parent webinar. This is an activity that we are continuing also. It's done once per month, and this is every third Thursday. And we would have partnered with GISP for this one, and it was really fun and interactive. We also have a presentation slide on that one that you'll see a little later on. We have the ECC Read on the Corner. Now, this is an activity where we take our children outdoors. We have different stakeholders who are on site, and we are reading and interacting with our children. Our parents participate in this activity. And when they do, they actually see the fun, engaging ways that they can relate to their children. So it's not, reading is not seen as a chore, because here they get to reenact the stories, and our children, because their parents are present, you know, it does a whole lot for them and their personality. And we would have seen for the launch of International Day of Play, we would have partnered with the UNICEF. and they would have established the first of many hopscotch at one of our ECIs rather. Now, an exciting outcome that we would have had is our partnership with Amanda, who was a part of our parent webinar, and we would have seen our parents rediscovering their love for play. So I guess as we would have grown older, for parents, we thinking that if our children play too much, then something is wrong. But no, we want them to rediscover themselves and to know that playing is a part of the learning process. So things we're looking forward to. We're looking forward to behavioral changes, especially in the way that our parents tend to use disciplinary measures in Jamaica. We have seen where a lot of the times simple interactions and communications and even using play, because this is the child's work, how we can change that and make it better. From our parent play sessions, we're also looking to create parent mentors. So we want to see parents taking control of these sessions. So we can have them as mediators in the school, and this will in turn show increased parental involvement. So we'll have that reports coming in from our practitioners that our parents are more involved and that they would have been putting into practice all that they would have learned from our sessions. So you can go to the next slide, please. So just an outline of what we can do better. We are looking to create a parent hub where we're looking at one-on-one mentorship. So we're creating a buddy system for parents. We are seeking to pair a stronger parent with one who is not so strong, depending on the area. And then we are seeing how best that this parent can be a mentor for a parent who is in need. And when we are looking at similar and different parenting strategies so that we can strengthen each other. Okay. Next slide. Okay, go to the next slide. So here we are, and just to show you the activities that we would have done in our parent plays. So there we have our parents being interactive. We have them jumping rope. They are doing puzzles. We have mommy and daughter here, and they're skipping. And we also had our outdoor event where we had the health center in one of our parishes coming in and communicating with our parents in terms of health and nutrition and the proper diet specification for our children. You can move on to the next slide. And this is just a synopsis of our parent webinar. And here we have our Read Pandakana event, and our parents and stakeholders are there and they're interacting with the children. And as I said, we're outdoors. I have again. Thank you.
Thank you so much, Karine. And moving on to the next, again, continue to put your questions and comments in the chat. And then we've got Ala from Jordan.
Yeah, hello everyone, can you hear me?
Yes.
So I'm Ala Zagul, I'm from Jordan, and today I'm going to give you a brief presentation about parenting program Jordan from the WHO intervention point of view. So in the beginning, I'm going to give you a brief context about the Jordanian context. Approximately in Jordan, the children and adolescents marks like 40% of the population. And the country, as you know, harbors many families displaced from several countries. The number of refugees, according to the UNHCR data in 2024, were 710,000 refugees from different nationalities, mostly are from Syria. Now, regarding parenting experiences, it can be drawn from different initiatives. So currently, there are different actors in the field. One of the main actors are Welcome Sesame. I think you have heard about this program through a presentation from India. I don't know if it's the same program. It's called Welcome Sesame, and it's under the IRC. Now, as per the WHO intervention, there is a task force called the Early Childhood Development Task Force, which is chaired by the National Council for Family Affairs. And most of the interventions that working in the parenting and the early childhood developments, they meet on a monthly basis on those task force to discuss different opportunities, how to interact together, and how to make the parenting intervention better in Jordan. What we focus on, we provide support to the Ministry of Health to provide better services under parenting through their mental health clinics, through their health clinics in general, and through training their staff to make sure that there's sustainable programs and projects coming through. Can we move to the second slide? So actually, the parenting program is relatively new to the WHO in Jordan as an intervention. During the parenting month, we have done a social media awareness campaign focusing on the 5 main domains of the nurturing care domains, which are the good health, the nutrition, responsive care, learning and development, and security and safety. Regarding emerging lessons and exciting outcomes, so through this task force that I was talking about, we have shared and led a meeting to work on amplifying the impact of parenting projects and interventions in Jordan through the Ministry of Health, and also to avoid duplication through this task force. The second thing is that I'm going now to mention a training program or package that we're using, training the Ministry of Health staff, that has been accredited under something called continuing professional development, which is needed in Jordan for most professions for the renewal of their license. And it's kind of a motivation for them to attend the training and to keep updated with the new knowledge in relation to the ECD or parenting in general. So what we're doing currently under, there's a package and it's available as an open source in the WHO and the UNICEF website. It's called Care for Child Development. It focuses on children between 0 to 5. And this is the main training that we're focusing on with the Ministry of Health currently. As a looking forward, we're mapping the initiatives supporting parenting in Jordan to identify the gaps and prioritize the interventions. And also, we're developing a national standards for parenting interventions, because what we have seen through a multi-sectorial meeting that took place earlier this year, that there's a lot of programs, they call themselves parenting, and they do not kindly apply all the elements needed for a parenting program, whether the age limit or any other standards. So we agreed with the local partners and international partners and the Ministry of Health to work on a national standards for the parenting services to make sure that everybody is working on the same page and everybody is collaborating with each other to reach those standards and to make sure that their program is working under them. Also, those are actually the plans that we're working on for this year. And also, grandparents do play a very big role in parenting in Jordan. So we're training the grandparents through a nationally developed package that's tailored to the Jordanian context, so we can involve them in the process and make sure they're updated with the current knowledge about positive parenting and so on. Can we move to the other slide? So as I mentioned,
and just a quick time reminder as you wrap up. Thank you.
Yeah, just one last minute. So actually, regarding the training I was talking about, it's happening on 3 levels. So we have done TOT training for a national cohort of healthcare providers, training 13 of them from 12 governorates of Jordan. And those trainers are rolling out other trainings in several governorates in the north, south, and the middle. They are focusing on healthcare providers in the community centers and the health centers under the Ministry of Health. So currently we have trained just since the beginning of this year, 58 midwives, 4 nurses, 1 pediatrician, 14 general practitioners. And we're focusing on midwives and GPs because they're the one providing those services under the mother and child health centers under the Ministry of Health. Thank you and I hope it did not take a lot of time. Thank you very much.
That was perfect. Thank you so much. So next we're going to go to Anastasia to talk about North Macedonia, but also other countries in the region.
Hello, good afternoon, everyone. I am just going to say hi to everyone with the camera on, and then I'm going to switch off the camera just to make sure that I have a stable connection. So thank you so much for everyone joining. My name is Anastasia, and on behalf of the Center of Excellence in Parenting Alternativa from North Macedonia, I'm here to provide an update on our efforts to enhance parenting support programs in North Macedonia, but also the region, the Western Balkan region, and beyond the low and middle income countries in the global south, which is supported by Parenting for Lifelong Health and Lego Foundation. And we are really deeply grateful for GISP for giving us the opportunity to share our voice with the global community. So just a bit of a short regional context, the Western Balkans, which are comprising countries North Macedonia, Bosnia and Herzegovina, Serbia, Montenegro, Kosovo, and Albania, face a shared social economic challenges that significantly impact the mental health and well-being of children and adolescents likewise. And parenting support is critical in addressing these, fostering positive family dynamics and promoting overall community resilience. Now, let's parenting mind. So next slide. Firstly, we have established the first ever regional Western Balkan consortium of NGOs for scaling up and institutionalizing parenting programs. This consortium involves national and regional NGOs, ACOs from North Macedonia, Bosnia and Herzegovina, Serbia, and Montenegro currently. And this initiative aims to create an unified approach to parenting support across these countries. We conducted an intensive training workshops in North Macedonia for primary schools, for professionals in primary schools, equipping them with skills necessary to deliver effective parenting programs. Now, these workshops are supported by local governments, provide the best possible support for parents and caregivers. In North Macedonia, our programs have received successful support in several primary schools, which I said they are backed up by local municipalities, and this local support has been actually critical in creating sustainable and impactful change. Additional to that, our community engagement efforts have been very successful. We organized networking and inspiration sessions in local municipalities, along with combined in-school events that brought together parents, professionals, and teachers. And these sessions have been fostered in a strong, a strong sense of community and collaboration, which is, we find, essential for the success of the parenting. So next slide, please. When it comes to really the outcomes, one of the most exciting outcomes for our initiatives has been the increased confidence among local leaders and supporting parents. I think we can go one slide back, sorry for that, Amanda. So one of the most exciting outcomes from our initiatives has been the increased confidence among local leaders and supporting parents and addressing children's mental health needs. This boost in confidence is a testament to the effectiveness of our training programs and the dedication of the professionals involved. We have also seen enthusiastic participation from educators, child development professionals, and community leaders, and their engagement highlights the critical need for parenting programs and underscores the importance of a regional Western Balkan consortium. This consortium is vital for scaling up and institutionalizing parenting programs, ensuring they reach a broader audience and have a lasting impact. Next slide, please. So when we look collaborate.
Hi, Anastasia. Just sorry to interrupt, but I think you're breaking up a little. I don't know if it's just me, but just wanted to.
Sustainable evidence operation issues. This is very important. I think we need to continue our efforts in the achievement and success of our program. In line with that, let me switch on the camera. Is from my side. We are planning an event, a conference, to bring together major stakeholders, including policymakers, NGO, and private sector. And the aim of this event would be to network, to share knowledge, and raise funding for our initiatives. And this will provide a platform for discussing regional strategies, showcasing successful programs, and emphasizing the importance of sustainable parenting solutions. Of course, we welcome any ideas or contributions to make this event a success. And the last slide, please. To achieve our, we need to network better together. That's very, very clear. Collaboration is crucial, and we encourage policymakers, community leaders, and institutional organizations to invest in parenting support, and emphasizing a cross-border knowledge sharing among consortium members will enhance successes and challenges. Awareness about the importance of parenting programs is also vital. We need to normalize seeking in our region. We need to normalize seeking support and ensure that parents feel comfortable and supported in accessing those programs. And finally, what we have found is that leveraging the positive parenting experience can serve
Hi, Anastasia. I think you're breaking up a little bit and cutting out. So I don't know if you can hear me, but thank you so much. Oh,
sharing best practices and maximize the impact. Thank you very much.
Thank you, Anastasia. You broke up a little bit there at the end, but if there are any questions, we can address them in the chat. And just to say as well that we'll be staying on for an extra 15 minutes for discussion. So thanks to everyone who's able to stay and join us. Next, I would like to hand over to Shalina from Aga Khan University in Pakistan.
Thank you so much. I guess first I would really like to share with everyone what we did on the Global Day of Parents. If you can just play the video, and then I'll take through my presentation. So this is a few system strengthening activity where we would go to the leadership and do different parenting activity. We conducted some webinars for the parents on how to become a responsive parent, parenting well-being. Our setup is mainly related to promoting parenting in healthcare settings. So that is what we do. We went to different patients, we went to different families who were there, promoted the cause for parenting. We wrote some blogs, and that is all about it. So this is very little celebration with the resources that we had. I'd like to now take you through Pakistan in general and what Pakistan does for parenting as well. So yeah, if you could just keep, okay, yeah. So as you can see that Pakistan is one of the most populous countries in the world. Talking about it, that we have like a ratio of at least having 6.5 family members in one family. So definitely, whenever we talk about Pakistan, there is definitely a parent in a family structure that is there in the Pakistan. Recently, the parenting education trend has very recently started in Pakistan. With support from the government, different initiatives regarding health, responsive caregiving, nutrition, safety, and security, and with the inclusion of UNICEF interventions on playful parenting, etc. So it's a very recent paradigm, especially it emerged in the times of COVID when parents required a lot of support from different agencies. However, there is a lack of trained and qualified parent educators in Pakistan, which is a huge gap. We have a lot of psychologists, a lot of pediatricians, a lot of early childhood educators, a lot of youth educators, a lot of school teachers who come up with their own ideas and provide parenting education. But there is a lack of qualified, certified training available for people who want to pursue their careers or who want to really support community by providing parent education. There's also lack of policy, if you would see and pick up Pakistan Women in Health or Women and Children policies. So there's no such policies other than basic leaves for parents. And those leaves are also very limited to women. So there's a lot of gender disparities in those policies as well. There's no as such national action plan as well, which would particularly focus about supporting parents, their welfare, their economic and social support. There are also a lot of cultural diversity and climate changes that Pakistan is undergoing, which is impacting parenting to a massive level. Be it climate, be it the worsening economic condition, be it the support and the low availability of technology and electricity to support techs as well. What we do at Early Childhood Parenting Readiness Education Program, that is why we call it ECD Prep, at the Department of OB/GYN at the Aga Khan University is we provide parenting education from pregnancy till age 8. This is the first time ever in Pakistan that we introduced the parenting education formally from the healthcare settings. What we do here is we provide a lot of inpatient and outpatient setting-based parenting education. So, we would take one of the sessions on early childhood development, child development in our antenatal classes. We have integrated our early childhood nurturing care, entire 5 modules in our outpatient setting, in a settings where people would come for their postnatal checkups. We also offer a lot of parenting counseling sessions as well. Then the other component we focused on, we started training the healthcare providers. So we started the intervention from the tertiary care hospital, moved on to our secondary care hospitals, and also the hospitals and healthcare settings in Pakistan and Afghanistan's remote area. We started building up policies in the system to integrate parenting education in almost all the departments. So, for example, we have family medicine. For example, we have community health. So we requested, and there is a rise of a lot of programs that are already happening within the healthcare setting from different platforms to provide that support to the parents as well. We also started building some knowledge and research and advocacy around the parenting interventions we are doing here. So we are seeing how our parenting education is influencing or impacting the responsive caregiving and responsive interaction of the parent and young children. How are they affecting their developmental health? For the youth mental health programs as well, whenever or wherever we are doing parenting intervention programs as well. We've also developed some massive content for parenting education, and we are making it available for free of cost for everyone. And I've just put down the links as well over here. And that is how our intent here from the Aga Khan University is to also influence academia to have a proper module in all teachers training, in all medicine, in all MBA-based programs, to have a proper module of parenting education over there. But that is definitely for the future day. Next slide. And definitely to acknowledge our partners, our University of Washington, and also the Parent-Child Interaction Center. So like I mentioned, the activities that we did around Parenting Month were simple advocacy, simple parenting education webinars that we do on the monthly basis, whether it's a parenting month or not a parenting month. We keep doing such advocacy and parenting education activities. The exciting outcome or emerging lessons we have generally learned by studying different parenting models in Pakistan is and also talking to different parents. So every year we train about 18,000 parents. So, we get to hear from them their problems as well. And most of them, they require support. They want someone to hear their problem and customize the training, customize the counseling, hearing their concerns, because one generic program does not fit all parents. And this is what we have learned from our programs as well. They also require more empathy versus resource and even more commitment. Because, we try to sympathize, this parent has this concern. But what they require is kind of commitment, our country's commitment to invest. Definitely when there are no youth mental health camps, there are no daycare services provided by the country. So ultimately parents have no platform that they can go. So we have also seen that parenting concerns are not limited to their parenting behavior, but also the resources they are being provided by the country. We've also seen media as one of the emerging sources, either healthcare sectors, education sectors, government sector. Either we have to take the approach through the media, or we need to rely on those trending viral reels that parents get to see, because we have seen that some content have a lot of evidence, but some reels are just so not evidence-based and which are just promoting random information. And parents are glued to that media as well. The parents, especially in urban settings, they rely a lot on media. So I think media is one of the challenges that we face, and also a platform that we can utilize. Our climate and economic conditions have majorly affected parenting, particularly in Pakistan. Last 2-3 years have been an economic turmoil in our country, and parents are finding it really difficult to provide quality learning. And with the rapid climate changes, there is either a heat warning or there is too much of a snow warning in the northern parts of Pakistan, which makes difficulty for the community workers to go and access the home-based approach for parenting as well. What we're looking forward for the future implication is...
Shalina, just wondering if you could wrap it up so that we have enough time for the final presenter and for discussion. Thank you. Please go ahead and wrap it up.
Sure, yeah. So in a minute, I'll just say that we would like to scale the parenting education programs in the areas which has or face multidimensional poverty, especially learning poverty as well. We would like to propose some policies, some manifestos to our government, and we would like to advocate our Ministry of Women and Health to have a formal wing for parenting education. And I guess together we can all work together as a collegial, multi-sectorial program for more parenting education program, and we need to really expand the communication channels. Thank you so much.
Thank you so much. So I think our final speaker is from South Africa. Vilmi, are you still online? I know we're going a little bit over time, but really looking forward to having everybody. Great. Everybody join for the last few minutes for discussion and final speaker. Go ahead, Vilmi.
Thank you so much, Amanda. And my presentation is only 3 minutes, so I have time to say, wow, colleagues, I think we need to take a second to just realize and celebrate the enormity of what we are collaboratively doing in the world to support parents. I am so proud of each and every one of you, and I feel privileged to be part of this esteemed meeting. Thank you so much. I represent SAPN, the South African Parenting Program Implementers Network. We've been working collaboratively since 2017, but AMLIC became registered entity last year in October. So we have been so busy doing things that we never had time for. So in June, the following happened in our network, but we also want to acknowledge other networks and forums like the South African National Child Rights Coalition that's doing similar work in South Africa. So I'll start on a community level. We are currently implementing evidence-based and evidence-informed parenting programs across South Africa for children ages pre-birth to 18 years. On a provincial level, SAPN is part of a pilot study in the Western Cape province of South Africa, working with government and 16 organizations to establish and grow a community of practice for family strengthening program that is one of the pillars for violence prevention. The community of practice do not have one standardized program, but work with different principles and values, which forms part of guidelines. These guidelines aim to improve the quality of existing programs to become evidence-based. And this is a new way of thinking about scaling parenting programs. So we're really excited about that. Then on a national scale, we launched ParentLine. I know somebody mentioned tech and tech support. It's a WhatsApp support platform for parents and caregivers. It's a reliable source of parenting information, insight, and advice to help parents. Currently, we are focused on 0 to 6 years, but it's already growing in content and also has a referral system. Then we have been bringing stakeholders together from different sectors, research, government, corporate, and civil society for the last 2 years through our families in Davos. And now we focus on a more specific advocacy strategy. So SAPN's goal is to ensure that the government fulfills its treaty, development, and national policy commitments to sustainably provide the required services and support all parents need through a universal, publicly resourced, and evidence-based parenting support for nurturing care. Our focus is therefore more than just parenting programs that only benefit some children some of the time, but to focus on universal parenting support that includes the aspect that promotes responsive and nurturing care. And that is the reason why we are currently collaborating with the National Department of Basic Education to support their national parenting support strategy using the above mentioned approach. And then somebody mentioned fathers. SAPN held a fatherhood as a role workshop earlier this year to better understand the role of the fathers, why fathers are absent, and next steps to involve fathers in the parenting role. We are currently writing a collaborative research article with 20 co-authors on the themes that emerge from the workshop, and that will be published in the State of the Fathers report in South Africa in September. We have also started training of a facilitators corps for the Free to Grow program. It's a program that focuses on gender-based violence and violence against children. This program is implemented in a workplace, and the program was collaboratively designed by SAPN members. On an international scale, SAPN has made representations to the UN Special Rapporteur on 2 occasions and was part of the consultation on the Pact of the Future in May, preparing for the Summit of the Future that's happening in September. And through this engagement, we have connected with the Global Peace Foundation, and we are now exploring future cooperation between the 2 organizations. And finally, because we realize, as you all mentioned, the importance of mental health, not just for parents, but also for employees of the care economy, we are busy with the research to establish the wellness of all employees of SAPN. The research aims to establish levels of burnout, moral injury, and compassion fatigue, and to find possible solutions as a group through an emancipatory action research process. Thank you so much for the opportunity to learn today and be inspired.
Thank you so much, Vilmi. I think you said it much more eloquently than I will right when you started, but it's been great and amazing to hear about all the work that has been going into parenting from all these different countries all around the world in different ways, but still working towards the same goal. I really want to have a few minutes for discussion, but just before we do that, I just very, very quickly, maybe Claire, in a couple of seconds, you can speak about where we're going next and what we would like to continue doing with countries as a next step as part of the global initiative to support parents. And I know a couple of people have mentioned a magazine, and Claire will just briefly introduce that.
Yes, thank you, Amanda. And indeed, it's been wonderful to hear the perspectives from countries and all the interesting work and achievements that are being made. And we are going to follow on with this conversation that we've had today with a magazine that will really represent the voices from countries around the globe on what are they doing with respect to support to parents. And we are currently in the process of finalizing this, and we will launch it in about 2-3 weeks' time. So please keep a lookout for that. We'll be sending out some communications so that you can join in and read more about what countries are doing. So thank you, everyone, and look forward to chatting further.
Thanks so much, Claire. Thanks to all of our speakers. Now, I know we just have a few minutes left and we've already gone over time, but I really would like to open it up to discussion now to see if anybody has any questions, any thoughts. Please go ahead and just put up your hand or come off mute. Otherwise, I know there's a couple things in the chat that we can bring up. And there's also, I will mention as well that we'll share the recording, the notes, and all the links that have come up in the chat after this. But would anybody like to come in now with any thoughts, comments, questions?
So I think Amanda, instead of just a general conversation, I'd be really interested in hearing from colleagues. You know, we've heard, I mean, there's so much happening from parenting, and you've all been engaged in very inspiring things from Parenting Month over the last month. Can we just go around to the different countries to share some insights or ideas of how could we collectively carry that energy forward in the coming months? Like, what can we do together? What would be helpful? What would be useful? I know we'll do the magazine and all of that, but it would be really helpful to hear from you. I know it's been a short time to engage with each other, but it would be really helpful to just hear what would you want to contribute to advancing parenting, both in your country and around the world, and how can we all collectively support you to do that? So wanting to open up some aspirations for us collectively here. So Shalina, go ahead.
Thank you so much. I guess I just have 2 quick suggestions. Maybe, what we can do is that we can have like a parenting brief kind of a thing, like, using different models and just quoting the statistics. So, if we really want to convince our countries, we know that this is happening around the world and these are some statistically significant things. The next thing we could do is probably we could form a little task group from here, today's thing, and then launch it as like parenting task force, which I'm sure exists as well. But we can produce some sort of policy statements which directly affect parents. Because in our country, there are hardly any manifestos, any policies and national plans, and we should have it grouped for lower middle income countries and higher income countries, because resources lower middle income countries receive or may not be most of the time relevant to us. So I guess there's a high need to sort of bifurcate, seeing that, you know, how parenting can also be scaled at multi-dimensional poverty level, and what are the guidelines for that? Thank you.
Oh, amazing, Shalina. That's fantastic. Colleagues, if as many of you can turn on your videos, that would be so nice to be able to see faces. But I'm wondering, does anybody have any reactions to what Shalina shared, or if anyone has further ideas they'd like to share? Again, encouraging an open conversation here. So please share, please speak up in the last few minutes we have together. It's so special to have heard from everyone today.
Good afternoon. I am unfortunately unable to turn on my camera, otherwise you're not going to hear me.
It's okay, Anastasia. And I love it. Just unmute yourself and speak. Go ahead,
yes,
Anastasia.
Perfect. Thank you so much for this. That our experiences, policy making activities that go towards supporting parenting programs do remain on, at least in our region, remain on the policy makers level. If we look at it horizontally, they do cooperate interdisciplinary between themselves, but in many cases, what we found is very successful, the vertical cooperation between policymakers and different stakeholders, such as CSOs, and even the private sector. So really coming together to make sure that the people that are on the ground, and most of the time those are CSOs that have the direct impact and access to professionals and parents, are the ones that are the most successful in implementing, disseminating, and scaling up parenting programs. So I think I would encourage more of this vertical cross-disciplinary collaboration and communication between the different stakeholders involved in implementing parenting programs. I think that would be my my point of view. Thank you.
Thanks, Anastasia. Really important. Anybody else want to come in? Really, like, let's just do popcorn style. They call it popcorn discussions. Just who wants to pop next? Any other ideas? Any other thoughts? Any other reflections? Shalina, wonderful. Parenting Knowledge Dashboard is also one of the ideas. So we have the supportparents.org. Maybe Amanda can put it in the chat and welcome inputs on how we can make that better. Online open source knowledge, sharing MOUs, great. Start making reels for parents' education for all ages. Convert the Zoom call as a knowledge community by doing joint publications. Love it. Yeah, absolutely. Putting parents and systems, parenting and systems agenda, ensuring all hospitals and schools. Brilliant. Thank you, Shalina. Colleagues, anybody else? Come on, I demand at least 3 more comments before we close. Priyanka, can you unmute and share?
Hi, yes, I was actually just responding a little to Shalina, but actually we do language neutral videos as part of the parent playbox. So all of those 52 activities, we create a little video that goes out to parents or community health workers, whoever's going to be working directly with parents if they don't have access to a mobile phone. And so you can understand them regardless of what background you're from or anything like that. And they just coach the parent how to play with their child. And there's a little simple activity that you can do in your home with little to no resources.
Brilliant. Any ideas, Priyanka, about what we can collectively do? That your thoughts on that? And I know there's like 25 of us on the call. I know everyone has at least half an idea. We can put it all together and still make 12 ideas. But go ahead, Priyanka.
No, for sure. I mean, I'm going to look at the website as well in more detail, but recently the Global Schools Forum put together a resource bank for play ideas for International Day of Play. And I wonder if that's something similar that we can do, is like have a library of resources, solutions, programs, contacts of people that you can speak to, or programs that you can use in your own context. whether they're, they require some training or if they're open source or free, but just kind of a resource library, like a one-point stop where we can access that information, either clubbed into different age groups or different target areas like mental health or physical development or nutrition, play, and I think that would be a really useful way to keep this knowledge sharing going.
Wonderful. So knowledge sharing is coming out as a big idea here that seems to be in demand. I think we should wrap up. What we'll do is we'll collate these ideas. We'll reach out to you for more ideas, email us with more ideas. And yes, Pakistan 2025 in February and responsive caregiving. Amazing. So we will convene everyone again, especially when we're ready to do the parenting magazine launch. And thanks, Yvette, well noted about knowledge sharing. And let's keep this going. Let's keep the momentum for parent support going. Thank you so much to each of you for sharing this amazing work you do and joining us today. Wishing you all a wonderful morning, afternoon, evening, wherever you are. Oscar, so nice to see you as always. Big parenting supporter. He's a big champion. Thanks, Oscar. All right. Bye, everyone.
Thanks, everyone. Bye.
Bye-bye, everyone.